Are you suffering from persistent pain or achiness that can be exacerbated at night and worse with motions such as raising your arm? Hey everyone, this is Dr. Zach Quinn here at Performance Sport and Spine, and these are common symptoms of rotator cuff tendinopathy, which we'll be discussing in this video. So this condition most affects people in their 5th to 7th decades, and the pain can be anywhere on the anterior shoulder, the posterior shoulder or shoulder blade, and it can radiate down the lateral arm. And again, this is often exacerbated by raising your hand overhead or external rotation motions. So let's briefly review our anatomy. The rotator cuff is comprised of 4 separate muscles: the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. And these muscles work as a group to stabilize the shoulder joint, which is a ball and socket. So tendinopathy is a general term to explain overuse of tendon injuries, anywhere from acute to chronic overload, with the symptoms being pain, decreased exercise tolerance, and impaired function. So initially it was thought that as you raise your arm up, the tendon would get impinged or compressed between the 2 bones, wearing it out. And the higher you raise your arm, the worse it would get. Well, studies have found that actually the smallest distance between the 2 bones is at 70 degrees, and it actually increases above that. So this impingement model just doesn't really hold up. In addition, the shape of your acromion was thought that the more hooked it was, the more it would irritate the tendon. But again, studies have found that this is no more common in people with pain than without pain. So the big takeaway here is it's not a degeneration, it's more about age-related thinning as we get older that can be addressed with exercise. So the mechanism of injury for rotator cuff tendinopathy can be broken down into 2 groups: extrinsic factors and intrinsic factors. So extrinsic factors are excessive tissue load, which is by far the biggest one, and then rotator cuff fatigue. Intrinsic factors are aging, genetics, vascular changes, and altered load. Load management. This is basically changing different variables to let tissues calm down. So you can change the intensity, the frequency, or the duration. So if your shoulder's sore, the first thing is changing your dosage, doing a little bit less to let the tissues calm down. In addition, tendons really like 40 hours of rest. So if you do it Monday, whether you're sore or not on Tuesday, wait till Wednesday to do it. And then over time, you want to increase the intensity incrementally, as tendons don't like big changes, they like small systematic changes. Before we start the exercise portion, we got to talk about setting correct expectations, and there's 3 big points. Some discomfort with tendon rehab is normal, but it's important that it calms down within 24 hours and you do these exercises every other day. Secondly, it's going to take longer than you wish. It's probably going to take months, not weeks. And then lastly, it's really important to incrementally increase the load over time, allowing the tissues time to adapt and recover. So isometrics in the direction of symptoms. So against a wall or a pole, you're going to have your elbow to your side and you're going to press your hand into the pole in the directions of symptoms. So this is external rotation. So we're going to hold for 10 seconds, rest for 30 seconds, and then repeat for 10 seconds. And again, the intensity is something that does not increase the pain. Over time, we want to gradually increase the duration that we hold it and the intensity that we press. And here we'll demonstrate how to do internal rotation. So we're going to press our hand into the pole, and again, the same sets and dose apply, and again, the pain should not increase at any point during this exercise. It may be good to do flexion as well. So within a standing position, you're going to put your hand against the pole and then push upwards gently into the pole, creating shoulder flexion isometric. Again, the pain should not increase, and hold it for 10 seconds, wait 30 seconds, and do it again. And as the symptoms allow, increase the duration and into assisted external rotation. So with your non-symptomatic hand, you're going to help your symptomatic arm, and you're going to use this hand to rotate your hand upwards to tolerance and come back down. Now it's important that your upper arm is rested on something. And again, with the irritable version, we recommend 2 sets of 6 to 10 reps every other day, and it's important that your pain does not increase at all during the exercises. If it does, you need to decrease the range of motion or assist more with your other hand. So assisted shoulder flexion. So with your non-symptomatic hand, you're going to assist the symptomatic hand. And we're going to raise our hand up to about 60 degrees and come back down. Recommend 2 sets of 6 to 10 reps every other day, or longer if you need the symptoms to calm down. Some may benefit initially by keeping the elbow bent and having a shorter lever to put less stress on the shoulder joint. Or addition, sideline may be better tolerated initially. Shoulder flexion. In a standing position with your elbow straight, raise your arm up to 60 degrees and return slow and controlled to the starting position. Recommend 2 sets of 6 to 10 reps every other day. Some people may find to do it in a different plane more tolerant initially, and that's fine, or laying in a sideline position as we demonstrate here. So from there, we're going to bend our elbow a little bit to make a shorter lever, and we're going to raise our hand all the way overhead to 180 degrees and then return to a starting position. Again, the same sets and reps apply, 2 sets of 6 to 10 reps every other day. Once that becomes well tolerated, to progress it further, we're going to hold a small weight in our hand, keep our elbow bent, and raise our hand overhead. and come back down. Again, some people may find bending the angle of your shoulder a little bit is better tolerated. That's fine. But again, keep your elbow bent and make sure you get that full range of motion. And then the last version would be keeping your elbow straight, raising your hand overhead with the external load. And then as that shoulder gets stronger and the symptoms calm down, you'll incrementally increase the weight over time. Again, 2 sets of 6 to 10 reps every other day. Allow that tendon time to heal and then progressively load it. So for some more stubborn conditions, it may be helpful to add a slow eccentric. So with a moderate weight, we're gonna raise up all the way overhead and then slowly 2 to 3 seconds lower down. Now this will help the tendon to adapt and may help with decreasing pain at a higher level and increasing the intensity. Again, 2 sets of 6 to 10 reps every other day. And again, 1 second up and then 3 seconds down. So external rotation for the non-irritable version. So with your upper arm supported on a step or a bench and your arm at 90, we're going to rotate through our shoulder joint up to 90 degrees and back down, slow and controlled. We recommend 2 sets of 8 to 10 reps every other day. Over time, as your symptoms calm down and the shoulder gets stronger, we're going to slowly add weight in incremental levels by doing it this way. Also, you can add a band to increase the tension in a different manner. Challenge the shoulder in a little different way. You can lay face down in a prone position. So your arm at 90 with your elbow bent. Rotate your upper arm up towards the ceiling through your shoulder joint. Again, slow and controlled. And then over time, you can increase the range of motion and increase the resistance by adding an external load. So another way, in the supine or on your back version, you can do this with an unsupported upper arm. So with your arm at 90, you can rotate the arm down slow and controlled to the floor, making sure the motion comes to your shoulder, and then returning to the starting position. Again, recommend 2 sets of 6 to 10 reps every other day, allowing that tendon time to heal. Again, make sure the motion comes through your shoulder and you keep your arm and elbow at 90 degrees. The wall push-ups are a great way to start loading that shoulder in a pressing motion. So staying against the wall with your feet pretty close to the wall initially, I want you to press your hands on the wall and then slowly lower it down and then press back up. We recommend 2 sets of 10 reps every other day. Now, as you get stronger and you feel more confident in that shoulder and the symptoms are more tolerated, you're going to inch your feet away a little bit to make it challenging. At some point, a good progression is to go to knee push-ups, and then lastly to push-ups normal, on your toes, on the floor. And a row is good to kind of build the polars of the shoulder muscles. So again, start with a light weight in a rowing position. You can use a dumbbell or a band. You're going to just do a rowing motion, driving your elbow up to the ceiling in a tolerated position. I recommend 2 sets of 8 reps every other day. As your symptoms decrease and you get stronger, slowly increase the weight. Thank you so much for watching our video on this subject. We hope you found it helpful. If it was, please like the video and subscribe to our channel.